Good evening. Thanks for joining us. I'm Darlene Jones, and we know a lot of you out there have had a lot of questions about what's going on around our community, from the common cold to flu to pneumonia. So we want to help you keep you and your family healthy, and we are joined tonight here on Facebook Live by Dr. Tim Hendricks and Dr. Jesse Karen, both with Advent Health. Dr. Tim Hendricks is in charge of Advent Health Center Care.
Correct.
Locations, and Dr. Jesse Karen is the medical director at Advent Health Altamont Springs. Thank you all so much for being here. We know it's late in the evening, but so many people have a lot of questions about what's going on around our community, and so we want to hop right in and talk about what really is more common than a lot of the things that we are hearing about in the news right now, which is coronavirus. But the flu is actually much more common than that. Can you guys talk about that and what we're dealing with in our community regarding the flu?
Well, sure. We're actually still in peak flu season. So what we're seeing at CentraCare is probably upwards of 300 or 400 cases a week here in Central Florida of influenza. Most of that is H1N1. The state reports that the majority of the virus that's circulating is H1N1, which you may remember was our last pandemic in 2009 when we were talking about H1N1 was a similar type of crisis, looking at a new virus coming and how that would affect our community. But now that's progressed to just part of our routine virus that circulates each year. So that's what we're looking at right now, is dealing with the H1N1 and those people coming in with influenza, fevers, chills, and aches. 300
to 400, that's quite a bit. In fact, you talk about flu activity being really high right now, and it's expected to continue for a few more weeks. Nationwide, the CDC is reporting 66% of flu type A, and the majority being, like you said, H1N1, 96%. So flu activity is still kind of a big deal right now, and that's really what people should be concerned about.
Right, but if you look at the state statistics, so Florida Department of Health, we're even more H1N1 here in Florida than the rest of the nation. So either way, it's the flu, whether it's A, B, or H1N1, you still got a fever and misery that's going to last for a week or more.
And I want to remind you all that we're going to be answering your questions here tonight. This is about what you want to know from our health community here, our partners with Advent Health. And so send those questions in, type them in on Facebook. We're going to start getting to those in just a short time. But I want to also talk about the flu vaccine. Some people may want to know if it's too late. We know 173 million people, doses of the vaccine have been given out. Is it too late, Dr. Karen, to get a flu shot?
No, it's not too late. We're still in flu season. We're still seeing, as Tim mentioned, about 300 to 400 cases. So I would definitely recommend, if you have not done it, it's a good idea to still go get it.
And the CDC recommending anyone over the age of, what, 6 months get a vaccine.
Yes.
How long does it take that vaccine to actually kick in?
Actually about a week to 2 weeks. Yeah.
So, I mean, if you get it today, then in 2 weeks from now.
Well, yeah, we want to make sure that the public's educated. You want to get your flu shot back in the fall, so you're ready for the whole season. But the people that are at highest risk of complications from influenza, if you haven't got it, we want to continue to emphasize to getting the flu shot. Now, what some people are asking is, well, why are we pushing the flu shot so hard in reference to coronavirus? And it's like, does the flu shot prevent coronavirus? No, it doesn't. But right now, if you walk into a CentraCare or into the ER, and if you have a fever, we're probably going to diagnose you with the flu. If you can reduce that chances of getting the flu, it'll become easier to manage as we start seeing, if we start seeing, big if,
right?
All right, if we start seeing more cases of coronavirus in our community, because it acts just like the flu.
Yeah, right now we've just got a few cases.
Right, we want to reduce flu, however we can throughout the season, because people still have complications of flu. People die from influenza, anywhere from 30 to 50,000 patients a year nationwide. We've already had 9 deaths, pediatric deaths in the state of Florida. So 9 children have died of influenza so far since the start of our season. And those were preventable by a vaccine.
And let's get even more basic here. The common cold. Millions of people get the common cold. And it's like we forget about that when we hear about things like flu, things like the coronavirus. But the common cold really is still the most basic type of illness you can have this time of year.
Yeah, exactly.
Yes.
Talk about that a little bit. How many cases of just the common cold, people coming in thinking they have something more serious?
Well, it is cold and flu season, so I think
Lots
probably
of
equal
patience.
numbers.
Exactly.
I know this is a busy time for the emergency rooms, for urgent care centers. So yeah, we're probably seeing a lot of those people coming in with simple upper respiratory infections.
Let's get to something that everybody is talking about, the coronavirus. We know that a lot of people are worried. We don't want to scare people. Really, this is the time to be calm and just really educate yourselves about what this virus really is, how you can prevent it, and just keep you and your family healthy. If you haven't traveled to China, there really is virtually no risk of infection as far as we know.
You're correct in that right now they're very low risk in the United States and in Florida, even though we've had 2 reported cases here in Florida. I understand maybe a third.
Yeah.
Just not keeping up on the news today. But this is an evolving, ever-changing process, and we just have to be educated and prepare. And that's what our hospital systems are doing right now, is meeting, preparing, working with the health departments to be ready if this thing gets busier. Reminding everybody that the coronavirus, we deal with coronavirus every day for the common cold. And so we see people come in with fever and runny nose, et cetera. Could be the flu, could be a rhinovirus, it could be coronavirus. These are viruses that are out in our community. So we need to be ready, because we're going to have more people coming down with these types of symptoms, and we're looking at increasing number of patients coming into our system. Same experience we had in 2009,
Yeah.
New virus, more sick people. We just need to be ready with our systems. Is that going to happen? It's anybody's guess, but it's being monitored very closely. We're ready as a system. Right now, you walk into any CentraCare emergency room, doctor's office affiliated with Advent Health, and we're going to ask you, have you been to China or one of the other 5 countries that has that we have activity in, and do you have symptoms? And if you do, we screen you and decide and call the health department for guidance on next steps, because we want to keep our staff safe, identify those patients if they're out there, but we haven't had any yet, and be ready for when more people come in with these types of symptoms.
I want to start getting to some of your questions from Facebook, because a lot of them are starting to come in. Jomaris Bias has asked, is the cough a dry cough, or is it more like flu symptoms with mucus when you're dealing with something like the coronavirus versus the flu?
I believe from what I've read, it's more of a dry cough. It's not a wet cough. And with the fever, so the symptoms of coronavirus would be cough and a fever. Sounds a lot like the flu. And so, but we're talking about some people actually develop chest pain, difficulty breathing, and at that point, they would be in the emergency room handled by, in a higher level of care than we would at CentraCare or in a doctor's office.
And I want to remind everyone that we are getting questions here on Facebook Live, so I'm not being rude to the doctors here. I'm looking down, trying to see what kind of questions are coming in. Linda Dombrowski-Roberts is asking, wanting to know, when is one contagious? How do you know if you're contagious?
If you have symptoms. So once you develop symptoms of the flu, if you have a fever, if you're coughing, you're having symptoms, you're contagious, whatever virus, whether it's the common cold, the flu, or coronavirus, it's all the same. There is an incubation period with coronavirus. So specifically, to answer that question regarding coronavirus, there is a incubation period that runs from 2 to 14 days that you can develop the symptoms. So it could be as short as 2 days or up to 14 days. There is with SARS and other similar viruses in the past, we weren't so concerned about being contagious prior to developing symptoms. There's some research to say that there may be a possibility of transmitting that before you actually develop symptoms. There's not a lot of evidence right now on that, but they're researching that.
Dr. Karen, I want you to chime in, because as a mom of 3 boys, kids go to daycare, they bring these germs home. Sometimes it's a cold, other times it could be a flu. We've even had a case of pneumonia at my son's school. My question is, sometimes as parents, we hear this question, or doctors tell us that once your child has started antibiotics, then they're no longer contagious. Can you talk about that a little bit when we're dealing with things like the flu, like the common cold? At what point from the moment you start taking the antibiotics are you actually still contagious?
So one misconception is that antibiotics will help all infections. They actually only treat bacterial infections. So what we're talking about right now, the flu, coronavirus, your common cold, these are viral infections. So unfortunately, antibiotics do not do anything to help them. Now there is, like for the flu, there is medicine called Tamiflu, which if you start early on in your disease process, within the first 3 days, that can help decrease the duration of your symptoms. But We don't know if that's effective with the coronavirus as far as testing going on for that right now. They have been doing some testing with that, but we don't have any clear data as to that right now. So again, what can we do to help our children? We're certainly washing hands, keeping things clean when we are sick, trying to avoid contact, particularly with high-risk populations like the very young, elderly people, people that are immunocompromised. That's probably our key defense there, keeping things clean, particularly if someone is sick in your house, making sure you're washing your surfaces frequently.
Yeah, so I just want to make it clear. So if, for example, you have something like the flu, you really should just stay home. Taking the antibiotics does not mean you're not contagious any longer.
Exactly.
And again, antibiotics aren't going to help a virus, but when we look at these types of infections, what we do every day right now, what we've recommended for years, is if you have the flu, you stay home. If you're sick with a virus and you're coughing and runny nose, you need to stay home, because this will prevent transmission to your coworkers, to your classmates, etc. That's a difficult thing to do, and a lot of us, when we have the cold, we want to push through and go to work. And now we've
I hear it all the time.
Exposed everybody
Taking
else.
one for the team.
Yeah, exactly. Come on, you can do it.
No, you're giving it to the team, right? Exactly.
But in the absence of a treatment or a vaccine for a new virus like we're talking about, really it's all about the basics, and that is staying at home if you're sick. Keeping your children at home. So a lot of the planning as we look forward to how do you plan for an event like this is you got to start thinking about daycare or staying at home. Not daycare, you don't want to take your child to daycare,
right.
please.
No, I know.
But what I mean, or care for home care and who's going to be with the children and that type of thing, because really it's important that when people get sick, we want to keep them out of the, keep them home, isolate as best you can, so we're not transmitting it. And as Dr. Karen said, to those medically fragile people. I personally, I have heart disease. So I'm thinking, all right, well, heart disease, I have a stent, right? So does that put me in a higher risk group with something like coronavirus? I think so.
Probably.
All right, he's agreeing. All right, I got a consultation there. Yeah, all right, there you go. So now I found out. So, I would ask that if in the future you get sick, try to avoid me, please.
Right. We were talking about the distance even before we went on air. We were sitting really close together, and we're like, well, that's kind of
right. And I think we're starting to think those things out.
Yeah.
The transmission of a virus like this, flu, upper respiratory viruses, these are all viruses that we cough or sneeze. These are droplet transmission. They're not hanging out in the air around us. Just being in the room with somebody that has a virus, you're not going to get it. If you're office mate in the cubicle over next to you is coughing, you're not going to get that. You're going to get it if you go over and say, hey, how you doing? And you touch their, the surfaces, and you touch your mouth and face. So hand washing and not touching your eyes or mouth or face, and staying home if you're sick. These are some of the basics that we have to emphasize over and over again, because these are key to stopping the spread of viruses.
So someone is asking here, what about going to the airport? And you kind of answered that question. Unless you're going up hugging everybody in the airport, you're probably not going to be at risk of just getting something in the air.
No, not just casually walking through an airport. No, same thing, malls, stores,
Let's talk about the RSV versus the flu. RSV is something we haven't really heard a whole lot about, but it has popped up quite a bit in the news over the last year or so. Can you talk about RSV symptoms versus the flu? Or is there really?
So RSV, again, is an upper respiratory infection, viral infection. We don't see it so much in adults. We see it more frequently in children. It's a much bigger deal with them because their airways are smaller. They tend to get swelling in the airways, and it can make it difficult for young children, and mostly infants, really. You're talking about children under the age of 2. They can be having respiratory problems and having difficulty breathing, and occasionally need to be hospitalized with this. But as we get older, we've all been exposed to RSV multiple times in our life, and we generally are pretty tolerant of that kind of infection, unless, of course, this immunocompromised population, of course, has a greater risk.
I've heard you say this more than once now tonight. You're talking about those vulnerable populations, very young or very old. Is that the general rule with a lot of these viruses, whether they're bacterial or?
Pretty much, yes. So you're looking at you're very young, under the age of 2, are going to be a higher risk of complications, and older patients. But the people in between, people with medical problems, so diabetics, asthmatics, people with heart disease, you know, those types of people those are the people we need to get their flu shots every year because those are the vulnerable people. You know, we do hear occasionally of young, healthy people, the 9 kids that have passed this last year or this last season due to influenza that did not have any predisposing factors that will put them at risk. So those things happen. And as I indicated, we've lost a number of people this year already from influenza. I think I read the CDC said 15,000 to date that's estimated.
18,000 is what I read. The latest numbers they put out just a couple of days ago.
Now those aren't reportable, so those are estimates. The only thing we have to report in the state of Florida is a pediatric death, that they actually keep track of those numbers. But yeah, so it is an estimate, and you pretty much estimate by the number of hospitalizations. And
Robert Liana wants to know, does the coronavirus go away on its own? So if you don't get any treatment,
from an infection standpoint. Well, we hope it goes away right now.
Yeah, I know, right?
If it just left tomorrow, we'd be happy.
No, but if I get it, I don't get any treatment, I just stay isolated in my home, will it just eventually go away?
It's like a cold. So it is a cold virus, a common cold virus. Those coronaviruses will run their course in anywhere from 5 days to 2 weeks or more. And in a very small fraction of people, there may be complications or hospitalizations. So, you know, if you look past the headlines and look past the fear about complications and deaths, the reality is we're looking at probably 1% of people that get a coronavirus, or this new coronavirus, will actually you know, die from that. Okay, so we're talking about a very small fraction. And that percentage is going to get less because information continues to evolve. We're getting scientists, there's reports published weekly I've been reading about information coming out of China. But the problem is we've got a lot of mild cases in China that we don't know about. So that mortality rate that we talk about is probably going to be a lot less than 1% when all's said and done, once we get more information. Plus, we're looking at different populations. You know, what's the nutritional status of those people that were initially involved? You know, how did they have other complicating factors? Is there a higher rate of smoking in the area? You know, cigarette smoking. So there may be factors that could be different in one society as opposed to Florida.
Let me ask you this. Someone here, Elizabeth Scott, wants to know, do you have any test kits available? I'm assuming she's wondering, like, at the hospital, are you able to test someone?
This is a really important point because we get this question a lot.
All the time.
Yeah, people pop in and say, test me for coronavirus. We don't have a test. The CDC does the test. And as of, I think Saturday, the governor announced that they're going to be releasing tests to the local health department labs. So there's a lab in Tampa, a lab in Miami, and a lab in Jacksonville, so that we can get the results back quicker. But
that's important. Why?
So, you know, it's a faster diagnosis and knowing the staff that's involved and tracking back and trying to, because right now we're in the containment phase. You know, we're looking at the 3 cases that we've had in Florida. The public health agencies are working hard to make sure we contain those, identify all the people involved, test those that develop symptoms so we can actually do the detective work and keep this from spreading any further. But unfortunately, we don't have a rapid test. I would love, and probably in a few weeks or months, we might have a test where you can walk into CentraCare, I can tell you right away, like I can with the flu right now. So that is evolving, and we hopefully will have that developed soon. So, but right now, the health department is not going to test you unless you meet criteria. You've been in China, you're within the last 14 days or one of the other countries that's affected right now, or you've had contact with somebody with COVID-19, the coronavirus. Now, so that would be some of these people that, you know, the 3 people we've identified, they're testing. What happens with the tests, so we do a bunch of tests, we get the results back in 4 or 5 days, so now it's going to seem like kind of an avalanche of positive tests.
You're scrambling trying to figure it,
Right, but that's just a delay in testing, that's all. The cases are already there.
Angie Corey is asking, how long does it take one who is otherwise healthy to recover from this virus, and how long typically until they aren't contagious? We kind of touched on that a little, but specifically.
Well, we handle it just like the flu. I mean, the assumption is that once your fever's gone, you know, I tell people you cannot go to work with the flu until you're 24 hours free of a fever and symptoms. That that holds true, we believe, for coronavirus. Once the fever is gone, symptoms are resolved, you've got a good solid 24 hours, you can go back to work and you won't be contagious.
What's your message to employers? Because there are quite a few comments on here where people are saying employers need to understand what you all are saying. There are employers who unfortunately would rather you just come to work to get the work done, but that's not a great idea.
A lot of information coming out and guidance from the CDC right now to help employers with being more flexible with time, call outs from work, vacation time, PTO time.
Working from home also options.
Yeah. Exactly, telecommuting, and understanding that not one of the things that I commonly get is, can I get a doctor's note?
Oh.
But
you still do those?
All the time.
Yes.
Wow. Okay. No, I remember those as a kid. Though you needed a doctor's note to go back to school.
Yeah, some employers have pretty restrictive, requirements for absenteeism. But the CDC is saying we really shouldn't be asking for doctor's notes, because if you have mild symptoms, and that makes you access health care that is already strained by more people being sick.
Oh, wow.
Just to go in to get his doctor's note is just putting a strain on the system. So the CDC is talking to employers saying, look, there are some things we need to start considering and moving forward. And this is all part of that planning phase as we move forward. This information's coming out and hopefully getting out to the employers.
I have a question. It's not on here specifically, but someone is wanting to know, Lamaris Colin Torres is asking the best way to clean, disinfect your home, your school, your work area. And I'm going to piggyback on that and say, does hand sanitizer really work?
Yes.
Yes.
Because sometimes I use it and I'm thinking, okay, do I still need to wash my hands? It still feels gooey. But
so hand washing is probably your best option, and you should wash for the correct amount of time. You have to be washing for 20 seconds. So as you think, probably most of us are not washing our hands for 20 seconds, unfortunately, but this is the time to be corrected about how to properly wash your hands. So washing your hands for 20 seconds with hand soap, any hand soap will work, and rinse it off with running water. That will do the trick. Now you can use alcohol-based cleaners. They generally have to be at least 60% alcohol though, and generally hand washing with soap and water is preferred, but that is an alternative if you don't have that around.
Does Lysol wipes work to clean the desk down, or should we be using something else?
As long as a Lysol wipe, if they contain sodium hypochlorite, which is bleach, dilution of bleach, not straight bleach, please, hydrogen peroxide, or alcohol-based. So I'm not sure what exactly Lysol wipes are contained, but any of those, the CDC is saying any of those types of chemical wipes are appropriate for wiping down surfaces. And you got to remember the high-touch areas, the doorknobs, keypads on a phone, or your keyboard that multiple people might be using. So just think about handrails and things in your home and in your business also. Yeah,
people probably think I'm crazy. I walk around like with grabbing paper towel to touch handles and everything.
Oh, I mean, if you walk into a hospital and watch a nurse wash their hands, they're using the paper towel to open the door and then disposing of it. They're not touching the handle. So, I mean, I do that, I'm sure.
Elbows and...
Yeah. And it's kind of frustrating when you walk into a bathroom and one of those air dryers and you're like, okay, how am I going to open this door and get out of here? And so
you wait for the next person.
So I'll just kind of hang out
I do too.
And hope, that somebody comes through and then slip out, right?
I know, I do it too. Yeah, it's horrible. I want to get to this question because it also has come up quite a bit. Folks are asking about the theme parks. Should they be going? We live in Orlando, a tourist destination. Florida really is a tourist destination. I don't know if you want to get back and touch on this idea that there's nothing in the air that you can, get with these viruses, but there are quite a few questions people are asking. Is it really safe to go to the theme parks right now?
I'll probably be there this weekend, annual pass holder. So, I mean, that's not a concern for me because, again, we're looking at a very low incidence here in Florida. Anybody coming from an affected area is not going to be flying in and getting off the plane here. Our government has already shut down that method of people coming into the country. So the likelihood of running into somebody that has coronavirus is the same as going to the store at this point. There is a concern, of course. We're in an international destination, which is interesting because last year or 2009, that's when H1N1 showed up here. We were one of the first cities to have H1N1, so we do want to monitor for that. At CentraCare, we are a reporting site for the CDC, just like the emergency room, so we can see where there are clusters of people that have unusual symptoms, and the CDC watches out for that.
Rosemary Staveley is asking, when should you see a doctor? Now let's talk about that in the context of things like the common cold, the flu, and then if you want to touch on the coronavirus, when to see a doctor.
Well, I'd say right now, if you have risk, meaning that you've had exposure to somebody that has coronavirus, unlikely in the community. If you've traveled recently from one of the affected countries and you have symptoms, it's time to call your doctor ahead. Talk to a physician to see if you are at risk of coronavirus. Now, those are very unlikely situations, but we deal with these daily at CentraCare, so we get people coming in wanting to know, and a lot of time it's reassurance. Yeah. You know, they just flew in from London, and now they've got fever symptoms. Well, we check them and they've got the flu. You know, I can't tell you how many people have come into CentraCare, and I've gotten the phone calls from our providers. You know, we're just making sure everything's cool here, but their flu test was positive. Then it's probably the flu. So it's very unlikely at this point.
And what about the flu? Like, when should you decide to go see a doctor? Because like if you rest and just rest, you should be fine over time, right?
Well, I'm gonna defer to him to talk about the ER visit. Yeah.
So a couple things. So I think that when you have the flu, the important things are taking care of your fever, you know, alternating between Tylenol and Motrin as long as you don't have any allergies to those. Making sure you're keeping yourself well hydrated. Again, washing your hands, trying to maintain distance from any other people, not infecting other people. I think, you know, most people get well, they have illness for 5 to 7 days and then they're better and they go on their lives. Now, occasionally people do develop complications. They may develop shortness of breath, chest pain. When you're starting getting more symptoms like that, feeling weak, lightheaded, maybe passing out, those are things that you want to seek medical care. You know, if your symptoms are persisting for a long period of time, you're not able to keep any fluids down, then those are things that, again, to contact either your primary care provider. If your symptoms aren't too severe, if you're not having shortness of breath or difficulty breathing, chest pain, you're not passing out, then you may be able to contact your doctor or go to CentraCare. Those are certainly options. Now there's e-care is an option also for people to do too, where they don't want to go to other places. And then, but if you're getting short of breath, if you're passing out, you're having chest pain, that's when I would say that's probably a good idea to go seek care at an emergency department, particularly if you have these comorbidities that we talked about. Excuse me, or in a vulnerable population. So.
Yeah, so going to the emergency room probably shouldn't be your first.
Right, and we want to make sure that people get the message that unless you're having difficulty breathing or chest pain or those crisis type of symptoms, you know, the child is disoriented, severe headache, those types of things, that's when you go to the emergency room. If you have you know, just straightforward fever, chills, aches, and a cough, come to CentraCare. It's probably the flu. We'll get you on Tamiflu. You want to get on that medicine within 24 to 48 hours. As we move forward you know, into perhaps dealing with coronavirus illnesses, we want to take a step back and say, all right, do you really need to be in the doctor? Are these just a runny nose and a cough and you feel fine? Stay home. What we call self-care, distance yourself from other people. And we really need to limit, you know, oh, I've got coronavirus, and run down to the ER and test me, which we're dealing with right now, which puts a strain on our system to treat the people that really are sick
really
and need
the help.
attention.
So I'm going to ask you the big question that everyone wants to know. In fact, just before we came out here, I was on Instagram and I saw a friend of mine traveling to Atlanta, and she said, ready to take flight, and she had a mask on. And I thought, well, she's sick. So I messaged her. I said, hey, are you good? And she said, oh, I'm just trying to protect myself. Do these things work? I mean, they're flying off the shelves. People can't get them on Amazon. Does it work?
Well, no. I mean, I'd just be flat out frank that, you know, what we're talking about is we mask our patients when they come into CentraCare that have a cough. The surgical mask, so just the ones that loop around, they're not tight fitting. We put those on patients to help them when they cough and sneeze to prevent. So imagine we call them surgical masks for a reason, because that's what a surgeon's wearing in the operating room, so they don't cough or sneeze into whatever they're doing, right? These are not designed to, you know, to prevent the transmission of bacteria or viruses, but it protects me from you if you're wearing one and you're sick. Okay, so that's the idea on the surgical mask. The N95 masks are there for medical professionals that are working within that 3-foot barrier, or 3-foot barrier, 3-foot
perimeter.
You know, perimeter thing, that's the word. So that 3-foot perimeter where there is a chance of transmission of those droplets. So, you know, we've been mask fitted working for our hospital. those make sure that there are several sizes, that they fit tightly and snugly, because if they don't, and you're wearing an N95, which everybody's buying up right now, N95 means 95% of 0.3 micron size particles, but
which means we don't
very small particles.
Right.
Viral particles. But if they're not fitting tightly when you breathe in, and they're difficult to breathe through those masks, if you've ever worn one, it'll draw air in from the side. So if it's not properly fitted. So when I say they're really no good, it's giving you a false sense of security, and there's a lot of, I just need to do something, and that's human nature. But we don't recommend using the mask, when you go out in public. It's really not gonna prevent anything. You got to work on the basics. Washing your hands.
Yes, wash your hands, people. I will tell a funny story about the mask. So I had a baby recently, and I got really sick, and I had a fever for several days, and I went out and got a bunch of these masks, and I was wearing them around the house. I was a sweaty mess, and it actually fed my fever. So it made me feel worse over time. And finally, my husband said, take that thing off. It's not doing anything but making you hot. So
I think that's interesting, that because we have to medically clear people to use those masks. So as an employer, we have to go through and ask questions. Do you have heart disease, lung disease, et cetera? Because you may not be medically qualified because of the stress it puts on your system, because you have to work extra. And I was reading a study that showed that the heart rate actually goes up while you're wearing one of those masks because of the extra work associated with it that you're not realized. So, we want to make sure our public's safe. Using those masks are a false sense of security. And I would argue that they don't do a good job. And I know our Surgeon General tweeted out. Yes, somebody finally said it.
Yes.
Because there are experts that are saying, well, maybe they help, maybe not. And it's just, we just need to get some definitive statements on this. And, my wife, who's not medical, she's not a nurse, she's like, should we get a mask? I'm like, no, it's really not necessary. And her family's concerned. And so I just reassure you that we want our healthcare providers to have access to these critical respirators, these masks to filter out the virus when they're treating sick patients. And right now, because of the panic that's out there, these masks are hard to come by. So we have adequate supplies. Hospital systems have adequate supplies, but they're not making them in China as much as they used to.
Well, and they're probably not going to get over here.
We've got to make sure, and that's where I think that again, there's a lot of discussion about what's the socially responsible thing to do. When you're sick, you stay home. Don't buy up all the N95s. Leave those for your healthcare providers that are on the front lines, that'll be fighting the virus in the future.
One last question, and then we are going to wrap up, only because I did get quite a few folks asking about this. Can you make your own hand sanitizer? Have you heard about this phenomena? Had not heard this.
I'd be interested to see the formula. In theory, I mean,
just wash your hands.
Yeah, I guess you could pour isopropyl alcohol over your hands and do the same thing, because it's alcohol based.
Yes.
Would you agree?
No, I agree. Yeah. I'm sure online you can look up ways to do that.
I'm a big fan of just using soap and water and washing your hands.
Yes. Yeah. That's the answer.
Yeah, that's the easiest answer.
Yes, and another quick note, folks are afraid to tell people they don't want to shake hands, but I think now we have a really good reason why we don't need to shake everyone's hand, so.
It's hard to do.
Yes,
especially when you see patients that just, that human touch, it's important, but we got to start, and I do that. I shake hands with my patients when I introduce myself, but immediately, after the visit, wash our hands before and after. So, make sure we prevent that spread. But I think in a social setting, I think it's a good idea that we find something else to do.
Thank you, Dr. Karen and Dr. Hendricks, for your time tonight. And thank you all for watching and tuning in with us here on Facebook Live. You had a lot of great questions, and we will actually have this on our Facebook page in case you missed any portion. You can go back and look at it again. And Thursday night, we'll be here to answer even more of your questions about the coronavirus live and give you the accurate information you need to know. We have assembled a team of medical professionals and experts, local government leaders to help you keep your family safe and, more importantly, prepared. So continue to send us your questions through social media here on Facebook, also on Twitter and Instagram. And you can also send your questions to our radio partner, News 96.5 WDBO. We will answer all the questions for you here on Thursday night. Thank you so much for joining us. You all be safe out there tonight and enjoy dinner with your families. Good night.